Have you ever wondered why your golf swing, the thing that you love the most, is starting to feel more like a trap for your left knee? You wake up the morning after a round, and there it is, right inside of your knee, this nagging ache. Maybe it's sharp when you hit it, maybe if it's a dull throb that just doesn't go away. And the worst part of it is, you don't even know what you did wrong. You just went and played golf. You just went and did the thing that you love to do. Well, today, we're gonna change that. Because once you understand why your knee hurts, you can start doing something about it. Hi everybody, I'm Dr. Gayan Poovendran. I am a medical doctor and I have spent the last 15 years helping golfers get back to their game without surgery. If you've been following along with me in this series, you know that we already talked about the meniscus in our last video. That's the cushiony pad that's on the inside of your knee that takes a beating every time you take a swing. If you haven't watched that one yet, we'll link to it below. It's a great foundation for what we're covering today. Because today, we are talking about the MCL, or the medial collateral ligament. This is one of those body parts that you never really think about it until it starts to scream at you. And if you're a golfer with pain on the inside of your knee, this video is made for you. So let's get into it. What is the MCL? Simple anatomy first. Let's get things out of the way. Let's talk about what the MCL actually is in plain language. No medical textbook needed, I promise. Picture your knee as a door hinge. It bends forwards and backwards, right? Now that hinge joint needs something to keep it from wobbling from side to side. That's where your ligaments come in. Ligaments are tough, fibrous bands, kind of like really strong rubber bands that connect bone to other bones. The MCL, or the medial collateral ligament, is just one of those rubber bands. It runs on the inside of your knee here, from the bottom of your thigh bone to the top of your shin bone. It has one job: keep the inside of your knee stable and keep it from shifting when it's not supposed to. Now, in my last video, we talked about the meniscus, which is a shock absorbing pad that sits on the inside of the knee joint. The MCL is on the outside of the joint on the inner side of your leg. It's a different structure, but it's in the same neighborhood. See, meniscus here, MCL here. And like noisy neighbors, when one of them has a problem, the other one often feels it too. So when somebody tells me I have pain on the inside of my knee, one of the things that I'm immediately thinking about is that MCL. And if they're a golfer, my ears really start to perk up. Where is your pain? Before we talk about why this happens in golf, I want you to do something for me. I want you to touch the inside of your left knee, the part of your knee that's closest to your other leg, and gently press along that inner edge. Do you feel any tenderness there? Maybe a little soreness when you press? Or does it hurt when you try to straighten your leg after it's been bent? Maybe it aches after a full round of golf right in that same spot. If you're nodding along with me yes right now, I see you. And that's exactly what MCL irritation feels like. It's not this big dramatic thing. Sometimes it's not always a sudden pop or tear. Sometimes it's just a steady, frustrating ache that builds up over weeks or months of doing what you love. And the worst thing that I hear from patients is this: I thought I just had to push through it. Let me be very clear. No, 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 and no. This is your body talking to you. So let's learn what it's saying. Here's the big picture. This is the fundamental problem. Golf and the golf swing is a rotational sport. You're winding up your body, you're storing this energy, and then you're releasing it all at once to your hips, your torso, and your arms. It is beautiful when it works, but it is brutal on your joints when something goes wrong in that chain. Your lead leg, that's your left leg if you're a right-handed golfer, acts like an anchor during the downswing. Your whole body is rotating around it. And while that's happening, your knee is being pulled in multiple directions all at once. So there's a couple of causes for this. Cause number one is what we call the valgus stress, or the knee caving in. Here's the big one. During your downswing and your follow-through, watch what your left knee does. In many golfers, especially beginners, but this also happens in experienced players as well, that knee will start to collapse slightly inwards towards your other leg. We call this a valgus stress. Valgus is just a medical term that says angled inwards or towards the middle of your body. Every time your knee caves in like that, you are stretching that MCL, that little rubber band that's on the inside of your knee. You do it once, sure, no big deal. You could probably ignore it. But you do it every swing for every round for weeks and months. Now we're talking about developing a real problem. Think about it like stretching this hair tie. You pull it back a little bit, it bounces right back. But if I keep pulling this over and over again in the same spot, eventually it's gonna weaken, it's gonna fray, it won't stretch back, it won't bounce back, and eventually it breaks. Cause number 2 is something called forceful pivoting. The transition from our backswing to your downswing is a violent transition, and I mean that in the most mechanical sense possible. There is a rapid, explosive reversal of force, and right at that moment of transition, your lead knee has to handle a sudden changing cutting motion or a sharp, forceful pivot. And if your body isn't ready for that, if your muscles are tight or your mechanics are off, that pivot can overstretch or even partially tear this MCL ligament. This is actually very similar to what you may hear or see about in cutting sports like basketball or soccer. Now, golf is not as extreme, but it sure is the same principle. Cause number 3, torque and twisting. Now, here's where we're going to get a little bit more technical, but stay with me, because this one is a little sneaky. When your lead foot is planted firmly on the ground and your hips start to rotate powerfully towards your target, you create something called torque. Torque is a physics term meaning twisting force. That twisting force passes right through your knee. Now, your knee is not a great rotating joint. Your hip is, your ankle is to some degree, but your knee, as I like to say earlier, is really a hinge joint. It only likes to bend and straighten. It does not like to twist. So when you ask your knee to handle a rotation that should be coming from your hip or your ankle, it's going to protest. And your MCL right there on the inside is one of the things that takes the hit. This is what we mean when we say that rotation is stolen from the knee. If your hips are stiff, if your ankles are tight, your knee has no choice but to step in and compensate. And then it pays the price. Cause number 4 is the quiet villain, overuse. Let's talk about the one that nobody wants to hear about, repetition. Now, you may not have done anything wrong in one single swing, but multiply that little damage over 100 swings per round, multiple rounds per week, month after month. That's what we call repetitive microtrauma. Tiny little injuries that never fully heal before the next one comes along. This is how chronic MCL pain develops. It doesn't start with a pop, it starts with a whisper. A little stiffness here and a little tenderness there, and you ignore it and it gets louder and louder. And now you're on YouTube looking at videos about why your knee hurts. All right, I want you to do this with me. Pause the video if you need to, but I think you can do this while we're watching. Step number 1 is I want you to stand up, lift your right foot off the ground, and balance on your left leg only. Keep your left foot flat on the ground, and I want you to try to rotate your hips, just very gently from left to right. What did you notice? Well, there's a few things that you should be looking out for. Number 1, did your left knee start to wobble or feel unstable? Does your knee start to collapse inwards towards your other knee when you try to rotate? Do you feel like your knee is doing the rotation rather than your hip or your ankle? If you answered yes to any of those, you found out something very important. Your glutes, those big beefy muscles in your backside, and your ankle stabilizers are not doing their job. And when those muscles check out, your right knee or your left knee, whichever one is your lead knee, has to check in. It comes right into the firing line. Now, I hear you saying this, but this isn't about weakness in a bad way. It's about a pattern, a biomechanical habit, something that's crept in over years and months of playing without you even knowing it. And now that you know it, we can talk about how to fix it. So let's talk about some quick fixes to reduce your MCL stress. Now, these are not a substitute for seeing a doctor or a physical therapist if you're already in pain, but they are smart, simple things that you can start doing today to start reducing the stress on your MCL. Fix number 1 is flare your lead foot. Now, we already discussed this in our last video, but I'm going to repeat it here because I think it is the single most impactful setup change that you can make. When you address the ball, point your left foot outwards towards your target by about 20 or 30 degrees. Why does this work? Because it pre-rotates your ankle and hips so that they can absorb the torque of your swing before it ever reaches your knee. Instead of your knee twisting to compensate, your ankle and your hip are already aligned and ready. We call this creating a triple stack. Your ankle, your knee, your hip are all lined up properly. It's a small change, but for your MCL, it is a game changer. Fix number 2 is working on your hip mobility. If your hips are stiff, your knee will suffer, period. Remember that simple 90-90 stretch we talked about last time? The one where you sit on the floor with both knees bent at 90 degrees and you rotate your torso gently over each hip? This can significantly improve your rotational range of motion. So all you have to do is try holding it for 60 seconds per side every morning. Do this 3 weeks consistently, and I think you're gonna really notice a difference in how that lead leg feels during your follow through and your swing. Fix number 3, activate your glutes. Remember that balance test we did earlier? The knee collapsing inwards a little bit? The fix for that is gluteal activation. Now I know, most of you golfers out there have had that phrase burned into your brains from when Tiger Woods was coming back from injury and struggling with his swing. Your gluteus medius is a muscle on the outer side of your hip, and it is responsible for controlling the alignment of your knee. So when it is weak or if it's asleep, your other knee drifts in. A simple banded sidewalk or clamshell exercises just a few minutes before your round. This can help wake that muscle up, get it activating, and keep your knee tracking properly. If you don't know how to do this, your physical therapist or golf trainer can show you how to do these movements, or a quick search online will find some really great examples. Fix number 4. Don't ignore early symptoms. Now, I know this isn't a flashy fix, but it might be the most important one. If you're feeling that nagging inner knee pain after a round, take it seriously. Rest for a day, and if it persists beyond a week or 2, please go see a doctor. The MCL has a really good ability to heal on its own, but only if you give it a chance. All right, I want to leave you with this. Your knee is not betraying you. It is protecting you, but it's doing it in the only way it knows how, by making sure you stop and pay attention. The MCL is a tough little ligament that handles an enormous amount of stress in the golf swing. And when the joints around it, your hip, your ankle, aren't doing their job, it has to step up. And then it gives more than it should and more than it can. Eventually, it's gonna start telling you. Now you know what it's saying. Now you have a starting point. Here is my standard disclaimer. While I am a medical doctor, I am not your medical doctor. Not yet anyway. If this hurts or if your knee hurts, go see a professional in person. The information here is meant to be educational. It is not medical advice for your specific condition. Now, if this video helps you even a little bit, if it just gave you the name for what you're suffering from or what you've been feeling, please hit that like button and subscribe if you want to keep learning about how your body works in the sport you love. And also, leave me a comment below. Where exactly is your knee pain? How long have you had it? I read each and every single one. And if you haven't seen the last video on the meniscus, please make sure that you watch that one next. It's gonna help give you a lot more context on what we were covering today. Remember, take care of your body. It's the only one you've got. All right, now get out there, keep chasing those birdies, and I'll see you in the next one.